I think lumbar spondylosis is a very common degenerative spine problem in elderly people, and these people actually have the low back pain is the most common complaint, and getting benefited by taking so many physical modalities, and among them the SWD and IFT is most common. And that's why we decided to see the effect of SWD and shortwave diathermy and IFT, the effect in lumbar spondylosis patients, and to want to reach a final conclusion that which one is actually better. So myself, Dr. Shahina Sharkar, Assistant Professor from Savar Upazila Health Complex, Savar, Bangladesh. So this is my disclaimer slide where I mentioned that this study was taken after approval from the Ethical Review Committee in Dhaka Medical College Hospital and informed consent taken from all the participants. So this is the background and aim. So we all know that low back pain is very common, and among them 10 to 15% become chronic. And lumbar spondylosis is actually degenerative changes in the lumbar spine, which is causing pain and disability. There are so many different treatment options, and among them medications, physiotherapy, surgery, but effectiveness is actually varies. Among the physiotherapist modalities like SWD and IFT, and our aim to reduce pain and improve function. And our aim to see the compared effectiveness of shortwave diathermy and interferential therapy in lumbar spondylosis management. So this is my study methods. We done actually the randomized clinical trial, which is done in July 2019 to June 2020, and in setting of Department of Physical Medicine and Rehabilitation, Dhaka Medical College Hospital, Dhaka. So the participants finally was the 59 in lumbar spondylosis patient, those age actually in the range of 40 to 60 years, and was a pain for the last 6 to 12 weeks and having the VAS scoring 3 to 8. And we actually divided the participant in two groups. Group A who were their number in 30, and we given them the SWD and among the standard care. And in B group, in 29 participants, we given them the interferential therapy plus the standard care. And our treatment was for the 3 sessions per week for 6 weeks, and we measured the outcome by doing the VAS scoring for the pain and seeing the disability scoring by ODI scoring scale. And we measured at baseline, and we do 3 follow-ups at 2 weeks and 4 weeks and last 6 weeks. This is the flow chart of my patients, where you can see that initially the patient's number was 89, but when they don't meet the inclusion criteria, then we excluded 4. So getting number 85 patients, then we allocate these patients and divide it into two groups. And in allocated group A was 42, and in group B also 43 in number. But in subsequent follow-up, they actually getting a decrease in number. In first follow-up, drop number for group A was the 1, and in second follow-up drop number was the 3, and in final follow-up at 6 week number was 8. And in group B, in first dropout number 2, in first follow-up, and in second follow-up number was 4, and in final follow-up number was 8. And finally, we get 29 patients for group B patients at 6 week. So finally, we analyze these 59 patients and compare their effects. So ultimately, we get these results. So here you can see that both groups were significant improvement in pain reductions, which p-value was less than 0.001, and the greater improvement in actually the SWD group, which baseline was in group A 6.6, and for the group B was 1.3. So SWD is significantly more effective than IFT at weeks 2, 4, and subsequently in 6. And this is the disability scoring, which also gets significant improvement in IFT at weeks 4 and 6. So at last, we reach in conclusion that both SWD and IFT significantly reduce pain and disability in lumbar spondylosis patients, and among them, the SWD is more effective than IFT. SWD can recommend as superior physiotherapy modality for lumbar spondylosis patients, but we need further study with larger sample and longer follow-up actually needed. So inviting you to all visit Bangladesh, because these are the best places to visit in Bangladesh, which is actually blend and mixture of beauty with nature. And at last, I want to say something in Malaysian language, that is terima kasih banyak pakusan Aocprm untuk mengatur acara yang menakjubkan. Insyaallah akan bertemu dengan Anda pada masa akan datang. Terima kasih.
Thank you, Professor Shavina Shakar, for the interesting presentation. And looking at your conclusion,
Yeah.
you mentioned about the SWD is superior compared to IFT, for pain management. Do you take into consideration in terms of accessibility, the cost, duration, treatment, and all that when you make this clinical recommendation based on your study?
Actually, it's very difficult to reach a final diagnosis, because in last line I said that we need a larger sample and longer follow-up. But in 59 patients, as we see that in 59 patients, the patients scoring in VAS and the disability ODS scoring, which is better in the SWD group. So yeah, we can say that SWD, whenever patient come, we can prescribe them for the lumbar spondylosis low back pain cases, thus SWD.
All right, thank you. Nice presentation. All right, okay. My first question is, you mentioned that both groups they receive a standard care, SWD with standard care, IFT with standard care. So do both of them? I mean, they receive a medication, or I mean, still continue to do medication?
Yeah, both group they have we given them the conventional treatment like the physical exercises, instruct them about the ADLs, and we give them some medication like NSAID, muscle relaxants, and among with the additional is our study like SWD, and another group is IFT.
I mean, do all of them receive same medication, or in terms of the group with SWD have most of them already medication, but the IFT, just some of them medication?
Both groups actually received the same medication and the exercise as well.
Okay. So my second question is, may I know what are the reason of the dropout?
Sorry?
Dropout. The reason of the dropout.
Because actually, whenever we do that study, that was the COVID time. So yeah, that was the big issue.
So it's not because of the effects from the SWD?
No, right?
Not